invite Dr. Cromwell. There we go. And you can take it away as soon as you're ready.
Morning, everyone. It's a great pleasure to be here. My name is Ian Cromwell, and today I'm going to be talking to you about the, this is not good, social policy implications of social isolation. So just off the top, I want to make it clear that the opinions that I'm expressing today are my own. They don't necessarily reflect the positions of my employer. They don't necessarily reflect the positions of my party. They don't necessarily reflect the positions of anyone else unless you happen to agree with them, in which case they will reflect your opinions too. I did an undergraduate honors degree in health studies and gerontology for the University of Waterloo. I have a master's in epidemiology and biostatistics from Queen's University, and I completed my PhD from UBC's School of Population and Public Health in 2019. I'm also the founder of Locals Lounge, which is a music community incubator here in the city of Vancouver. And we try to build, connections through the local music scene. I myself am a musician. And I guess the reason why that part of it is relevant is that I've been, really motivated and animated on trying to build connection locally and using different mechanisms to do that in my spare time, as I've also been doing my sort of more scientific work. I currently work as a manager of health economics at the Canadian Agency for Drugs and Technologies in Health. The way that I sort of summarize my job is that I check big pharma's homework on behalf of the drug plans to make sure that they're not trying to slip one past us and allowing the public healthcare system to negotiate better prices from big pharma. As Julie mentioned, I'm also a candidate for Vancouver City Council with One City Vancouver. Not a lot of people have heard of health economics. Very briefly, the goal is to find the best use of each marginal public health dollar within a constrained budget. So we don't have infinite amounts of money to spend on things, and it's public money. So we have an obligation to ensure that that money is being spent responsibly and that we're maximizing the amount of health bang that we spend for each healthcare buck. And the practice is to consider a wide range of solutions to any given problem, and then choose the ones that represent the most cost-effective use of resources. Because a dollar that we have to spend on problem X is a dollar that we then no longer have to spend on problem Y. And so what we're trying to do is this very tricky optimization problem of how do we make sure that our public systems are working to give the maximum benefit as opposed to spending a lot of money on things that only benefit a small number of people. I'm going to talk today about my understanding of where the literature is. The scientific literature is on the health impacts of social isolation. But before I do that, I want to just take a moment. You may have heard this from other speakers. I just want to take a moment to really highlight and unpack this term social isolation, because it's not one particular thing. When you look at the literature, there's a lot of variety of what specifically is measured. And so one might say, how many people do you have in your social network who you could rely on a crisis? And another is, how many friends do you talk to on day to day? And how often do you feel lonely? And all of these things are sort of aimed at the same general concept of social isolation, but they aren't actually measuring the same thing. And so what that does is it adds just a lot of uncertainty around how strong an effect is. So it makes it very difficult to say this works better than this, because oftentimes they're not making apples to apples comparisons. So we have these sort of overlapping and related concepts that aren't exactly identical. And so unfortunately, I'm not in a position today to talk to you about this. Here is the single most important and impactful thing that we can do, because the literature just doesn't allow us to do that. This is an emerging topic of inquiry in the scientific literature. People have obviously been talking about social isolation for a long time, but the impact that it has on health is a relatively new phenomenon. And so today I'm going to be talking mostly about the relative effect, like this will increase or decrease something, not totally focusing on the absolute effect of it will decrease it by X% versus this other thing, just because those comparisons are really just not possible. So I just want to make sure that I'm situating how strong you can walk away, how much of this you can take to the bank. I'm certainly not going to make any claims that are really strongly definitive, but rather just where the literature suggests the direction of effect is. So social isolation affects our health, and that I think is sort of the bottom line. What I'm going to try to get you to walk away with here is that it has, in addition to having all of the other issues that we may think of, that social isolation can be understood as an epidemic. It can be understood as a health problem, including at the individual level. So there's good emerging research to suggest that when we have poor social relationships, fewer close social relationships, people end up having increased risk of things like coronary heart disease and stroke. So these are physiological effects that are akin to the kinds of effects that we see from smoking, from alcohol use. These kinds of individual health effects are related to high levels of social isolation. We also know there's some evidence to suggest that social isolation affects our mental health, our levels of depression, stress, and other related disorders, as well as immune system dysfunction. So, chronic illness, as they are related to these other things, are also associated with high levels of social isolation. And consequently, and through other mechanisms, we see a pretty clear signal from the literature that all-cause mortality, so death from any cause, is highly associated, significantly associated with social isolation. Being isolated literally kills us. But it's beyond the individual level effects that social isolation has on health. We also have to think of the impact that it has on the health of populations. And so this is where my sort of epidemiology background really comes to bear, because we also know from the recent COVID pandemic literature that a high level of social trust is positively correlated with uptake of vaccines, of adherence to social measures. And so what we see is a negative correlation to mortality. Fewer people died of COVID in societies that had higher levels of social trust. And so our ability to stay connected to each other and to feel as though we trust and know each other has effects on how we treat each other. And we've lived through, or many of us have lived through, the last couple of years where we can really see the immediate effects that we have on each other's health. We also saw from the heat dome last summer that social isolation plays a role in population health there as well. More than half of heat dome deaths that occurred in BC last summer were among people who lived alone. People had no one to check in on them. They had nowhere to go. They ended up dying alone in their rooms from the heat. And it's also important, this is a theme I'm going to come back to a number of times. It's important to recognize that there is a strong correlation between social isolation and age as it relates to health risks. So the burden of social isolation is felt predominantly by older adults when it comes to the health effects that it has in terms of these sort of mortality and morbidity measures. And then zooming the lens out a bit farther, social isolation has impacts for the health of our society. So not just the physical health, but also just the health of how we relate to each other and how our civic institutions are impacted by it. Again, this is very, very early emerging literature, so I don't want to draw too strong a correlation here, but we did see a correlation between loneliness and xenophobia and the endorsement of authoritarianism in a study that was conducted in Arizona. When we do not trust each other, we tend to otherize each other more easily. And that leads to a certain endorsement of certain types of political beliefs, or that shows up in our political beliefs. And that has an impact on the health of our society. We also saw that people who were socially isolated were more likely to vote for Donald Trump. Um, Irrespective of your beliefs about the individual person, it is more or less inarguable that this represented a strong move away from sort of societal norms, and sort of what had been acceptable within political discourse, and did lead to a lot of fracturization within American society. There is no strong evidence to suggest that social isolation leads people to accept conspiracy theories. This is something that I sort of believe to be true, but the evidence does not necessarily suggest that. But it does suggest that among politically segregated communities, where the only people around you are people who believe as you believe, that correlates highly to a belief in conspiracy theories, which again has impacts on how we govern ourselves as a society, how we treat each other. And so the question now becomes, we know that these effects exist, that social isolation has all of these cascading knock-on effects. So what is the right approach to addressing this? And I'm going to argue today that, we don't live in a country, we don't live in a province. Where we live is in cities and in neighborhoods and in communities. That is the social environment in which we have our social connections or not. And that as a result, more so than the federal government and more so than the provincial government, it is actually municipal governments that have the highest impact on our day-to-day life and who we're exposed to and how often. Arguably, because municipal leaders live among us and are our neighbors, this is the most responsive level of government. It's the one where you have the most direct impact because it's just your community that it affects. But that's not to dismiss the important role that senior levels of government have to play. Simply that if we are looking again at this sort of dollar for dollar, what is the most impact that we can get? My argument, my belief is that that's happening at the municipal level. So let's talk about the municipality. The Vancouver Foundation did some surveys prior to the pandemic, and found that about half of Metro residents say that it's hard to make friends. I think that this is something that a lot of people, just anecdotally, have relayed to me, is that it's hard to meet people in Vancouver. About a sixth of our population say that they report feeling lonely, either almost always or at least often. At its highest, again, we're talking about disproportionate impact. This is highest among younger people. It's highest among lower income earners. And in fact, among young people, City Hive just published a report on the priorities of young voters in Vancouver. And social isolation and making friends was ranked within the top 5 of their concerns. As far as what is interfering with our ability to make friends and to stay connected, finding people who have similar interests was the number one perceived barrier. But also, people felt like it would be easier if other people were friendlier, and it would be easier if there were more common spaces for us to hang out with each other. So we've got good reason to believe that there are population level solutions or municipal policy solutions to address some of these problems that people who live in Metro have identified. There is an emerging and an interesting set of literature that suggests that weak ties, the people who you see on a daily basis, your favorite barista, your neighbor who walks their dog at the same time that you walk yours, these kinds of just casual, not necessarily deep connections, not, these are people who know you inside and out. But just people who you see and who recognize you and who see you, those not only inform the formation of new friendships, they may eventually become people who know you well, but your general sense of well-being as well. Just, do you feel connected? Do you feel like you belong in your community? Those friendships that you form play a meaningful role in your life satisfaction, your sense of belonging. So do you feel like you belong here, or do you feel like you are isolated, that you are surrounded by people but alone? And what's interesting is that neighborhoods that have higher levels of cohesion, where people do feel as though they belong, are associated with a higher sense of safety. People just feel more at home. They feel safer. They don't feel so alone. And that's, being alone is scary. But also that leads to, or is at least correlated with, children and adolescents being able to play outdoors, which is really important for their development and the development of healthy communities more broadly. People's emotional well-being and self-rated health, particularly in older adults, is higher when they feel as though they have connections with other people in their neighborhood. And this is all coming from an evidence backgrounder from the Hey Neighbor Collective that I strongly recommend reading. It's got some great stuff, some of which I'm summarizing here, but there's quite a bit of depth there. So the goal should be to build cohesive neighborhoods, a city where people do feel that they are connected to each other, they do have these casual interactions, that they do develop this sense of belonging. And the city of Vancouver is not indifferent to that. In fact, back in 2014, Vancouver passed the Healthy City Strategy, which specifically talked about, among many other things, the importance of social connection. And so there were a number of potential remedies that were suggested, making it easier to have small scale events, particularly in public spaces, having cultural celebrations and other things that bring people together. And there were some specific metrics that were set out about, we want to make sure that everyone in the city has some number of people in their network. And then again, getting to this sort of civic health thing, is looking at, does this actually increase our willingness to participate in the democracy? There was also support for car-free streets and complete neighborhoods. So the idea is that if we're not dodging traffic all the time, it'll be easier for us to be out in public places and connect with each other in meaningful ways. It's also a lot harder to have a conversation with someone who you're driving by than someone you're walking by. But what's interesting is that there was no explicit mention of the role that housing plays. And I bring housing up because it's probably the single biggest municipal lever. It's the thing that the civic government sort of spends the most time on, has the most influence over. And it's worth kind of digging into that, because there is good reason to believe that the way that we organize housing has an impact on our level of social connectedness, and therefore on our level of health. That housing is in fact healthcare, for a number of reasons, including through this pathway that includes social connection versus social isolation. And so we see from the literature that there appears to be an association between people who live in co-housing. So that's one building that has multiple units, but also a number of shared spaces, like shared kitchens or shared amenity rooms and stuff. So people are neighbors, they have their own places, but they also spend a lot of time with each other. That there's an association between that style of living and psychosocial determinants of health. And that's not surprising, that if you share a kitchen with anyone who's lived in a dorm, will remember, you just bump into people casually. It's not that you have to make a point of going out and finding people. They are around. You have your privacy, but you also have regular social contact. There is, for the same reasons, there's good reason to believe that co-op housing has the same type of benefit. This is so individual units, but people sort of share a complex and they'll share public amenities. Interestingly, anecdotally, I've been doing some door knocking at co-ops, and the number one thing that people say when you ask them about where their living situation is how much they love feeling a sense of community and being known by and knowing their neighbors. I knocked on the doors in a co-op that I actually lived in when I was a baby, and there are people there who still remember me, and I have not been a baby in a very, very long time. So there is enduring community that just comes from the actual built form of the housing. But that cuts both ways, because there's also evidence to suggest that apartment style housing, where the only things that you share are hallways, have diminishing returns on social connection, particularly among older adults. So compared to like townhouse style or other forms where there is sort of a more even spread and people are coming and going more easily, apartments actually do tend to be isolating depending on how we design them. And so I guess the take home message here is that the housing style has to be tailored to the different needs of different populations. It's not that one type is better in all cases than the other, but rather that a diversity of approaches are going to allow people the kind of housing that they need. And this is important because, you know, recall, and from the previous presentation as well, social isolation does not affect all groups equally, right? It's not a one size fits all. There's an equity component to this. Older adults, low income people, disabled people, there are structural barriers that exist that exacerbate the problems, and healthcare and subjective health reasons why certain people are going to feel this impact at a higher level. The urban, rural, and northern Indigenous housing strategy notes that there are specific gaps for Indigenous households where the culturally appropriate form of housing is one that allows multiple generations to live side by side. And if we have isolated single-family housing or apartment housing where people are living in different parts of the city because that's what they can afford, that is going to have a serious impact on certain groups more than others who may be more accustomed to living in that way. And so again, I want to just come back to this. There is no one size fits all approach to this. There needs to be a variety. And so the municipality also, in addition to housing, municipal governments have the ability to build other forms of community infrastructure. So other places to gather, parks, libraries, community centers, especially for people who live in apartments. If you can't get 10 people into your apartment for a dinner party, you will need to use public spaces. And we've all noticed that especially during the pandemic, of how much we all sort of needed to use parks a lot more as ways of, and outdoor spaces as ways of meeting. Given that the number one identified barrier to having more friendships was not knowing people who share your interests, the municipality has the ability to create events that foster those kinds of interests to allow you to meet other people. So that's sport, that's recreation, that's music, that's other things that people are interested in doing. And then for new Canadians, refugees, immigrants, people who are coming to this country who are not familiar with the culture, who may not have facility with the language, the neighborhood houses that exist in cities like Vancouver plug people in immediately to a nurturing and caring, supportive social environment. And that is something that the municipality can invest in as well. Beyond just creating the space for people to interact, though, there's an important role that the municipalities can play in incentivizing people to go into those spaces. If we make cities denser, which for a variety of reasons we should, that means that we are going to need more public spaces to gather. It is just a fact. And if we don't provide people with the reason to go out into those spaces, they may default to staying in their homes, which will further isolate them. And so in addition to having just the container for the space, we need to put something in to draw people in. And that we can create incentives to do that, but we can also remove barriers that make it hard for small scale community groups with little funding to actually put on events. We can remove some of those barriers and make it easier so that all communities can thrive by having events and amenities in public spaces. All of this is happening in the background of the climate emergency and ongoing COVID. And we know that emergency situations magnify existing inequalities that exist within our society. And so any change that we propose has to prioritize the people who are at the bottom end of all of those inequities. We also can't just go back to the kinds of decision making prior to the onset of COVID, or in a time when the climate emergency wasn't as obvious a thing. We need to be adapting to this new reality, and that requires thought and planning and consideration. The other thing is that as we build more connected cities, we're going to increase the diversity of types of perspectives around the table when we're trying to tackle important problems. And all of these problems, including social isolation, the climate emergency, COVID, you name it, all of these things require collective action. And that kind of collective action is actually easier and better when we have a number of different perspectives around the table working on common problems. So a more integrated and connected city is also a more politically functional one. So just to wrap up, as we are talking about solutions and approaches to social isolation, I would invite you to take a health economic lens on this. My discipline is about evaluating the trade-offs of value for money. What are we getting for each dollar that we spend? We know that addressing social isolation is going to yield multiple health benefits that sort of stack on top of each other. And instead of looking at these as individual issues, we should be thinking about the structural and environmental factors that create isolating cultures, including how we design our neighborhoods. And also to remember that the impact of social isolation is disproportionately felt by certain parts of the population, and so our solutions should prioritize those. We should not do a one-size-fits-all approach, and we absolutely should not do what works for, you know, well-housed, middle-class people who don't really have any other problems besides social isolation. We do need to think of this through an equity lens. That's it for me. As I mentioned, I am a candidate for City Council. I'm running with One City Vancouver. If you're interested in hearing more about how this type of thinking and this type of work shows up in our policy platform, you can reach me at ian@onecityvancouver.ca. You can see our policy platform at youbelongyvr.ca, and you can find more about me at linktree/iCromwell. Thanks so much.
All right, thank you so much, Dr. Cromwell. Hopefully you'll be able to stay in the chat